illustrious speakers. And what we can do is go ahead and get started. If you haven't done so already, kindly mute your microphone. And so for today, I am Jeannie Houchins, and I am with the Health Forum. And I also have with me Joanna DeBow, who's the program coordinator at Proceed's National Center for Training Support and Technical Assistance. She's in the background managing the chat, Q&A boxes, and the polls, and we're both very happy to have you spend the next hour and a half with us. And again, what we're going to hear today is a webinar on racial equity approaches to social determinants of health for Asian American communities. So just a little housekeeping before we get started. So this webinar is being recorded. The webinar is also going to have a PowerPoint, and the resources will be available afterwards. So you'll get 3 pieces of information: the webinar recording, the actual PowerPoint, and resources in the next day or so. Your microphone has been muted, just in case, and will remain so for the duration of the webinar. So if you have any questions during the presentation, you'll need to type in your questions in the chat box, which is over to the right on the Zoom panel. We'll bring them up during the 3 Q&A sections after each panelist presentation. And then also in your control panel, you can find the audio settings, which is over to the left on my screen. That actually shows not only the audio setting, but also the chat box to communicate with us and other attendees, both publicly and privately. If you have any questions, please chat with Joanna and she'll be able to assist you. So before we get started, just a little bit about our organization. So the Asian Pacific Islander American Health Forum, also known as HF, is the oldest and largest health advocacy organization working with Asian Americans and NHPI, Native Hawaiians, Pacific Islander communities across the nation in the US territories and with US affiliated Pacific jurisdictions. The Health Forum influences policy, mobilizes communities, and strengthens programs and organizations to improve the health of Asian Americans, Native Hawaiians, and Pacific Islanders. This webinar is the second session of Proceed's NCTSTA 20-21 webinar series titled Raising Voices. This series is focusing on raising voices of those vulnerable populations to increase awareness, reduce health disparities, and discuss how the social determinants of health affect these populations across the US. NCTSTA offers public health bilingual training and capacity building. And with that, let's get started. So, as I had mentioned, this webinar is part of the Health Forum and Proceeds NCTSTA's CBA. So, it's a mouthful of alphabet soup for health equity programs funded by the CDC. We hope that you can use the hashtags listed on the screen here and follow us on social media to help spread the word about the services and content that you see today. And without further ado, let's get to know each other. We're gonna, on the next slide, answer some of the following polls to get to know who's joining us on the line today. I'm gonna turn it over to Joanna.
Thank you. I'm so happy to be here with all of you. So we are going to go ahead and get to know each other with 3 quick poll questions. Our first question is, in which region of the US is your organization located? Options are West, Midwest, South, Northeast, and Caribbean. All right, a few more seconds to answer that. I'm going to close in 5, 4, 3, 2, 1. All right, so we have 17% from the West, 24% from the Midwest, 35% from the South, and 24% from the Northeast. All right, our second question is about your organization. So what type of organization do you represent? Are you from a hospital or medical group practice, a community-based organization, a government agency, either local, state, or federal, a healthcare clinic or federally qualified health center, or other? And if it's other, please let us know in your chat. Okay, I'm gonna be closing in 3, 2, 1. Okay, so 39% of you are from a community-based organization, great. 26% from a government agency, 17% from a hospital or medical group practice, 9% of you from a healthcare clinic or federally qualified healthcare, and 9% of you are from other, including a health justice organization and a philanthropy serving organization. And our last question before we move on to the best part of this webinar is, which of these groups best describes your position within your organization? Are you part of the leadership, a mid-management position? Are you a frontline clinical, a frontline non-clinical, or other? All right, a few more seconds. All right, if you're another, let us know in the chat. And I'm gonna be closing in 3, 2, 1. All right, 29% of you are mid-management, 25% are leadership, 21% are non-clinical frontline, 8% of you are clinical frontline, and 17% are other. And let me check the chat. We have an English Mandarin medical interpreter, great. And a community educator, all right. That is it for now, Janine. We're ready to continue.
Let's do it. So today's objectives are on the screen. And as we mentioned, this webinar focuses on racial equity approaches and strategies to address social determinants of health for Asian American communities. This event will mark the launch of the Community Highlights series, which provides examples of 3 Asian American serving community-based organizations, the populations they serve, and the needs they address, each through the lens of one particular social determinant of health. We will learn from each of these national leaders about the cultural informed programs that they designed to address the barriers to housing, transportation, and primary health services for Asian Americans in their communities. We've gone through the housekeeping on our agenda, and so we are going to dive right into our speakers. And our first speaker today is Victoria, and she is the Vice President for the Center for Pan-Asian Community Services, which is the first, largest, and oldest organization in the Southeast to focus on issues and concerns of Asian Americans and immigrants, especially women, children, and families with low income. For the past 11 years, she has advocated for language access, civic engagements, immigrant rights, cultural competency, transportation access, and direct services on the local, state, and national level. And since 2012, she has helped form and build the transportation fleet, serving immigrant and refugee families to address economic disadvantages and health gaps, a system that has now grown to more than 12 vehicles in her fleet. She serves on the Immigrant Hope Atlanta Board, Asian Pacific American Council of Georgia Executive Board, and is a previous chair for the Gwinnett County Multicultural Advisory Committee. And now I'm going to turn it over to Victoria.
Thank you so much, Jeannie, and thank you to Joanna as well, Health Forum and Proceed for just highlighting the work that we're doing here in the state of Georgia. I'm excited to be joining a great panel with Duncan and Elena as well. So I just wanted to wish everyone a happy new year. I know 2020 was just a tough year for all of us, and hoping that we are, having a better start to 2021. I'll share a little bit about what we're doing here in the state of Georgia, of how we're improving access to transportation and employment, but ultimately improving the health of our communities here in Georgia and the South. I'll talk a little bit about what's going on in Georgia. I'm sure you've been following everything that's been happening in the news, and share a little bit about what we do here as an agency at CPACS in Atlanta, and then get to the meat of this case study of talking a little bit more about our transit system. Who are we targeting? What kind of challenges are we seeking to overcome? And the 2 major transit systems that we have, how to start this type of project, and what is it that we're doing here in Georgia that could possibly impact other places that's trying to serve immigrants and refugee communities. And then we'll end with some recommendations, some best practices, what we've learned, and some recommendations for some of the providers that are here on this call. So thank you for joining us today. So what's going on in Georgia? I mean, without a doubt, you probably have seen us in the news with our 2 senatorial races, and maybe some of you have even dedicated some of your time and efforts with coming to Georgia or supporting us from afar, so just thank you for that. Georgia, we have one of the fastest growing voting eligible population, which is really incredible. And we see that with the growing Asian American Pacific Islander, or API, legislator caucus that we have here in Georgia. We make up about 420,000 of the population here in Georgia, and that makes about 5% of Georgia. And what's interesting is 80% of the API community, or again, the Asian American Pacific Islander community, resides in the Metro Atlanta area. So when you ask somebody and they say in Atlanta, they're probably maybe not in the Atlanta proper, they're probably in the Metro Atlanta area. And what's also interesting to note that in a lot of the work that we do, we have to make sure that we are providing access to language services. And it's because close to 54% of our communities are still limited English proficient, needing materials, vital services in another language. And 1 out of 3 of our community members are low income. And when people think of Georgia, sometimes they don't think Asian American population in Georgia. And we're still very much a first generation community in Georgia. And then maybe some of you are asking, do we have a Native Hawaiian Pacific Islander community here? We do. And the largest NHPI ethnic community is the Guamanian community and Chamorro communities. And something interesting to note is 2 out of 5 of the communities from the Guamanian or the Chamorro American community is our youth, which is very different from other areas of the country. And we started these programs because of the large concentrations of refugees in Clarkston and a large Asian community in counties like Gwinnett. Okay, next one. So on the left here, you'll see this is our beautiful building that I'm currently sitting in. And we've been in this building for about 11 years now. And we're very proud because a lot of our services have really expanded because of this location. We are a private nonprofit doing a lot of nonpartisan community work here. And our work is to serve immigrants and refugees, underserved and underprivileged communities. And we do that through ensuring that our communities are self-sufficient and also promoting equity. And it's through comprehensive health and social services, which I'll share a little bit more about, the capacity building, and then also doing a lot of the advocacy work here in the state of Georgia on a national level. Next slide. And direct service is our bread and butter. A lot of you are from community-based organizations, so you probably identify with this, of doing that direct service in the community. But over the last 11 or 12 years I've been with CPACS, it was really clear, right? It's not always enough for our communities to provide the direct service. We have to think about how do we build the capacity of our communities to be civically engaged, to change policies, change laws, and change some of the administrative process that prevents our communities from accessing healthcare, transportation, and or vital services. And that kind of moves us into the advocacy space of, ensuring that our communities are mobilizing, to run for office, right, to, influence and impact how our representatives are moving in terms of their policies and their actions and activities in the community. And so that kind of summarized, and this is what we called our 3-legged stool model that we, it's just a great way for us to kind of highlight what we do as an agency. So next slide. This may look a little bit overwhelming, but these are our 12 departments of services. And I could go a little crazy and just kind of spend all day walking through all of our services and programs. But this is what it is for CPACS every single day. And you'll see kind of the different branches, but it ranges from serving children, youth, and families, right? And, through health services, social services, housing, senior services, to interpretation, translation, advocacy, and research. And it just kind of runs the spectrum here. We have 250 staff, full-time, part-time, contractors, and seasonal. Now, it sounds like a lot, and because we serve 17 different languages, and that includes a variety of API languages, Spanish, Swahili, Kinyarwanda, some of our East African dialects, as well as French. And we have about 500 volunteers that help us do this. And we can't do this alone without all the incredible partners and community leaders that have been there with us really since the beginning of helping us expand and figuring out what are the needs of the community. Next slide. So let's talk about transportation. Who are we working with, and who are we serving? It's kind of similar to the general population that we serve here at CPACS, but we serve primarily low-income riders and those who are needing access to transportation. A huge limited English proficient community, and as you've seen in the earlier slides, we have areas like Clarkston, which is the largest refugee population anywhere in the United States. And they actually reside in the city of Clarkston, which is the most diverse 1 square mile in the southeast. And there we have, API, AA, and HPI communities, which is the Asian American, Native Hawaiian, Pacific Islander communities, the Latinx, Hispanic, Latino community, the African diaspora communities that we serve, Middle Eastern, and various other communities. And right now, we primarily serve in DeKalb and Gwinnett County, two large populations of immigrants and refugee communities. And so a section of our services are also geared towards seniors above the age of 60 and individuals with disabilities that need wheelchair accessible transportation. So I'm excited to kind of walk you through a little bit more about our services. And so how did this all come about, right? CPACS didn't just kind of start transportation overnight, and we didn't start providing van pooling, volunteer transportation, and doing this work, overnight. It was in 2012. But since 1980, we've been doing volunteer transportation and getting people to and from services. But it was in 2011, 2012 when my predecessors actually submitted an application to address some of these challenges that we were experiencing in our communities when they were trying to get to us or trying to get to a health center and or a place of employment. And that was, safety. A lot of our roads don't have sidewalks. They have to cross major intersections without hawk lights and crossroads to get to a bus system, and a limited bus system at that. There was long commute times because there was only one train system that we had, and it only went through 2 counties. And if you know Georgia, we have 100 plus counties, and it was very hard for our new communities to get to places of employment. And of course, refugee communities, a lot of our communities were being placed at employment sites outside of the immediate metro Atlanta area, so transit was just difficult to access. And if you've ever, gone on the metro or, hailed a taxi, it costs money. And so there weren't a lot of options for our communities because our communities were a little bit or economic disadvantage. And of course, some of the lack of the services there. Okay, next slide. And so in 2016, with one of our rider survey, we knew that our communities didn't have cars. They were newly arrived in the United States, didn't have access because of funding, or just didn't have access to driver's license because they're fairly new. 90% of this community needed support and access to public transit. And we've already heard language access. And if you've ever been in another country trying to access the metro, purchasing a card, and trying to figure out the system, sometimes it's hard when you don't have the language capacity or those to interpret or translate for you. And then the easy access. A lot of our community members, say that accessing an existing transit system is very hard. And it requires training again and support again every time the route has shifted or changed, or when it crosses different transit systems. Next slide. Okay. And then so maybe the question now is, okay, well, how do you fund this transit system? And I don't know if you see the bus that we have in the back right behind me here. It's, how do you acquire a bus? What money do you need? So we're very fortunate to partner with the Atlanta Regional Commission, and it's a quasi-government entity that works on improving the quality of life in the Metro Atlanta area and oversees the Metro Atlanta area. And you can see they've made investments of upwards of $93 billion for projects, transportation-related projects, through 2040. And that's really incredible because we want to make sure we have a regional transit system, regional connectivity to ensure that our communities can get to and from places that need to go. And very specifically, we are a sub-grantee of the Atlanta Regional Commission. This funding is through the Federal Transit Administration, or what we call FTA. And these are our three kind of grant buckets that we currently receive to ensure that we provide transportation for those who are seeking employment, seniors above the age of 60, and then also during COVID pandemic, how are we, pivoting to ensure that we address some of the immediate needs of our communities, and that's through our CARES funding. Next slide.
All right, so we're going to ask you a few questions. First question is, are transportation services currently included in your service programs and or grants? Yes, no, I don't know. I'm going to go ahead and launch that. All right, a few more seconds. Okay, closing in 5, 4, 3, 2, 1. Okay, Victoria, so 55% said yes, it is included in the programs and or grants, 29% said no, and 16% say I don't know. And the next question for this section is, we would like to know what public transportation options are available and used in your community. Please check all the applied. Do you have volunteer van pool transports? Are there any light rails, rapid transit such as subways, water transport, pedestrian? Is it accessible to walk, bike, and scooter in your neighborhood? Or most people rely on personal vehicles or other. If you have one option that is not here, let us know in the chat. And since this one is a multiple choice, I'm going to allow a few more seconds. All right, I'm going to be closing in 5, 4, 3, 2, 1. Okay, so what we have here is 77% say that everybody uses personal vehicles. We also have rapid transits at 59%. 50% say that their communities are walkable. We also have some water transport, some rapid transit, light rail, and volunteer transport carpools only at 26%. And among the others, we have here lots of taxi use, Lyft, Uber, and the bus. So that's what we have here. Very diverse communities.
Awesome. Thank you so much, Joanna. And thanks everyone for participating in the poll. And it's great to hear that a lot of majority of the individuals on the calls and organizations represented have already incorporated transportation systems or projects in their operations. And then to also learn that I think a lot of us are still, our communities are still residing on, personal vehicles, which is great, but then also, increase in, rapid transit, access to rapid transit. But I'm hoping that as we go through some of the services in more detail, that it will inspire or maybe provide, more opportunities for organizations to look into culturally and linguistically appropriate services for our communities, especially those with high immigrant and refugee populations. Okay, next slide. Okay, so what is it that we do with this funding that we receive? And how do we, convert some of this funds to the work on the ground for our communities? It's all about language access, right? And we have other transit providers that do this work. So people ask, well, why is CPACS, doing this when we have those transit systems, those private groups out there? And the majority of the reasons why is because of language access. A lot of our community members can't access because there aren't people that look like them that speak their languages, or the materials and the mobility education is currently not in language that they need. And so a lot of our dispatchers, interpretation translators are available to ensure that our communities can seamlessly navigate through the system, not just our transit system, but also the existing transit systems. And that's how we've been able to really partner with the local transit providers. And then we have the fixed and the flexible routes and on-demand routes. And so that's these are all new terminology for us in 2012, right? Because we knew we need to get someone from point A to point B. But these routes were really, eye-opening, definitions for us. It's, making sure that we had these standard, consistent routes for our communities, very similar to how, our MARTA or like the Metro for you guys, it comes at a certain time, it gets you to certain places. But for us, it's a little bit flexible because we knew we had to get off, into neighborhoods that just couldn't get to these bus stops for us. And then the on-demand, making sure that communities get to and from doctor's visits. That's not often on a consistent schedule, right? Or employment, sometimes we have an employer that'll say, tomorrow we're going to hire 12 people, and these 12 people need to get to orientation or their interviews. And so sometimes we have to kind of book those appointments to ensure that the clients can get to and from. And we're very proud of our carpooling and vanpooling coordination. In the past, we've helped some of our community leaders, gain, information on how to purchase their vehicle and help their own communities and neighborhoods get to and from employment. And then, of course, we have our senior services or employment services, two big departments that we, really rely on to help ensure that the services for our seniors and those seeking employment is being met. And then the voucher program, ensuring that funding is available to make sure that our communities can utilize existing infrastructure and minimizing the gap there in terms of, financial burdens for those communities. Okay, next slide. And then how do we do this? We have an exec team. We have directors in play to help with grant writing and also provide some direction and brainstorming with our mobility managers and our dispatchers and drivers. And all of the people that you see here are people from the community. And our drivers are all community leaders. And we were very intentional about that at the start of our transit system to ensure that our community, voice was a part of our system. So we were very intentional at reaching out to different ethnic groups within the refugee population and or API, Latinx, and other groups. Okay. And then our mobility educators are, again, individuals from our communities who knew where to go, how to access, how to get the information out to the community. And then also to make sure that the existing transit systems like MARTA, the county transit, and city transit systems were incorporated into this education system so that our communities can maneuver within the different transit systems. And then we have, you've heard a number of case managers and caseworkers and health navigators from our federally qualified health center to ensure that communities gain access to health services. Okay, next slide. And then here are some of the vehicles that we have. We've grown a lot since the last time. So I think we have about 15 vehicles, and we're planning to add 2 additional shuttle buses to ensure expansion in certain key areas for our communities. Next slide. Okay. And here's just some of the pictures of the work that we do. And you see the individuals on the left side with everyone in the chairs. Those were all of the prospective employees that we were able to transport to one orientation session. And majority of them were hired. Some of them needed additional support. But in the end, 100% of the individuals that you saw there were hired at that particular place of employment. And then you can see our individuals there in the middle. This was taken with some of our clients going to work, and we provide 2 weeks of daily services to ensure that our communities, could build up that additional funds and also time to build a van pooling or carpooling system. And then a picture of us providing gas cards and vouchers for our communities who are actively seeking employment. Next slide. Okay. And here's just a quick map, and I just wanted to share that this map was built by our communities with our community leaders to ensure that the locations are where our communities need to go. And this is what we call our flexible fixed route that we currently have right now. Okay, next slide. And, we want to make sure we provide language access, but also provide a system that meets the needs of our community. So we do surveys annually to ensure that the routes still make sense for our community and ensure that the drivers are, still in the community, and making sure that our community and mobility educators are, providing the right education for what the community needs. And of course, the partnerships. We work with employees, employee groups, employer groups, and with the community members to ensure that, if there's a need for a different community, for example, our East African community members, we recently partnered and hired one of our community leaders to ensure that the services are available to the East African community members. Okay, next slide. And I'll move through quickly in this next few slides, but wanted to share Mr. Lau's story here on the left side, and he was at an ophthalmologist's office. He's one of our seniors that recently moved to Georgia, and I believe he was from New York. He was having a lot of challenges getting to medical offices. He was having eye issues and having trouble seeing. And his family, and he had one daughter here that just couldn't get him where they needed to go because she worked all the time. And after seeking our services, he was able to kind of get to regular offices, office visits, and also get the care and surgery that he needed for his eye condition. And on the right side, we have our refugees here, Bhutanese refugees from the Clarkson area. And we have weekly services, and this is pre-COVID, of course, without mask, taking our seniors to grocery stores, community events, and then also getting them access to health services like diabetes screenings, and ensuring that our communities have access to this education. Okay, next slide. And very similar to our JARC, which is our employment grant, this is again is just serving our seniors 60 above and ensuring our communities get to health services like dialysis, diabetes support, and other health services and or social services that they need. Okay, next slide. And then again, this map is also created by a lot of our seniors. We had an advisory team to kind of help us, better understand where our seniors need to go. This is still a work in progress for us because a lot of our communities are not concentrated in one particular neighborhood or area, and so we're hoping to expand and modify this map soon. Next slide. Okay, and then I'll end with this slide. We couldn't have done this work without our great partners like the Atlanta Regional Commission, and now, some of our government partners, but also our community leaders from the Bhutanese, Burmese community, Chinese, Korean, and Vietnamese communities, as well as now our East African communities, to help us really better understand what the needs are, and then how to better serve, and then who to hire, what kind of trainings we need to provide. And also the employers. I think we've set up some really cool services with employers where they actually went and bought their own, coach buses to take people to and from, because we helped them set up that system. And that was something that we were really happy to do to build our capacity to better serve our communities. And of course, identify who you're serving, because each community has their own niche, has their own needs, and how they access transit services even prior to coming to the U.S. And we probably have all known now that the language services, without that component, I don't think our service would have been very successful. And then, making sure that our communities are a part of the process of planning, and then also build out, and then also expansion. So I just wanted to thank you again for your time, and looking forward to answering any questions that you may have about transportation. Thank you.
All right. So we're open for questions for Victoria. We have some questions already, so feel free to ask your questions. Janine, can you press? Thank you. Our first question is, how do you work with other transportation providers in Georgia?
Yeah, so we have actually received contracts with other transit agencies like Gwinnett County Transit, which has the largest Asian population, and we help them translate and interpret and also do outreach for their own transit systems. We also sit on the transit operators table with the region, And there we're able to usually annually present what we've been doing and also share best practices on serving immigrant communities, and brought our communities to existing training annex locations. You know, how to, they have these machines to help you purchase the cards, you know, for you to use the transit system, and these demo buses to kind of show you what it's going to feel like being on the bus. So we usually partner with MARTA, one of our transit systems, to provide the training in multiple languages. And so that's usually how we work with those transit operators.
Great. We have a couple questions on our Q&A. So before we answer this one, a lot of people are asking about the program. So they want to know, you know, if the agency contracts this services, or you run and, you know, all the logistics of the program, if you have work with transportation agencies outside of Georgia. So a little bit more about how the logistics work on the program.
Absolutely. We're all homegrown here. We don't have any contracts with external transportation systems or any third-party contracts. We actually have, and our buses actually parked right outside my office here. They're all parked in a parking lot. You know, hopefully one day we'll be able to grow to a point where we can expand to other areas and have third-party contractors. And hopefully those are community-led, community-based groups that could provide transit or transportation systems in their own communities.
Okay, we have a question about COVID. So how has your program shifted due to COVID?
Yeah, that's a great question. That is something that you know, it took us by we were all kind of pivoting and trying to figure out what to do, because a lot of our seniors could no longer move around the way that they used to before COVID. So a lot of our programs have been shifted to delivering hot meals to seniors instead of having our seniors come here for congregate meals. We're also doing a lot of delivery of food and produce to and from locations to ensure that that gets to our communities. But we've definitely seen a decrease in terms of the number of people that have been utilizing transit in general, just because a lot of our small buses, are smaller compared to those long, double wide buses, where you could have people enter from the rear door versus the front door. And just for safety reasons, we really had to kind of minimize a lot of our trips and really had to prioritize urgent trips and emergency trips where individuals needed to get to their prescriptions and or important medical offices. So thank you for that question. It's still a work in progress for us during this time of COVID.
Thank you, Victoria. We have two more questions. Is the service transitional or ongoing? Is there a means testing for eligibility with a cutoff point?
Yes, absolutely. So our goal is to ensure that our communities are self-sufficient. Our goal is to make sure that our communities are placed in meaningful employment. So for our employment program, we want to make sure our communities eventually graduate from our programs, right? So we have a kind of a 2-week program where we provide to and from places of employment, and we work with our refugee department or employment department or a third-party nonprofit that's helping a group of our communities seek employment. So we try to do that for 2 weeks, and during those 2 weeks, we help with the van pooling and carpooling to ensure that after those transit services end or the program ends, the community is able to, organize and, do their own transportation. There is an intake and a screening process that we do. We do have eligibility requirements for low income, and it often mirrors the SNAP and Medicaid program to ensure that our services are getting to the hands of those who really need services.
Thank you. And the last question that we have on our Q&A is, could you share some examples of how your organization has its voice heard in state-level public health policy decision-making? Examples include equity around vaccine allocation, monoclonal antibodies allocation or access, getting emergency funding for increased transportation funding. Like, how are you involved with this health policy decision-making?
These are really great questions, and that's something that we're currently doing right now, especially with the vaccinations and testing. We're a federally qualified health center, so we sit with the state primary care. table, and then also we sit with other healthcare providers in the state of Georgia to ensure that our communities are not left behind with vaccination disbursement. We work with the public health and the Department of Board of Health, ensuring that the voices of API, Latinx, and immigrant communities are there. We write comments. We also talk to our commissioners with the various state agencies and providing comments on what's really happening with the disbursement, where is it going, and we're always the ones that knocking on the door to ensure that our communities get the vaccinations, COVID testing, the equipment that's needed, and also the funding. That's one thing that we currently and will continue to do is ensure that the funding is equitable to communities like ours, right? Who people that may not know about because we're not often invited to the tables of decision making for where these resources are going. So I'd love to kind of expand more on that specifically with our health center, but I know we're also running out of time and would love to follow up with the person who asked the question directly as well.
Great. And just so you know, if you have any more questions for Victoria, you can still send them. We're going to have a final question and answer section. So do not hesitate to answer your questions. So before we finish with your section today, Victoria, what advice would you give an organization wanting to start a FTA funded program?
Yeah, absolutely. And we had a lot of providers on, and and if you've had federal funding before as a grantee or a sub-grantee, the potential is in the details. Make sure you get consultants on your end or experienced individuals to come on board. And the other thing is make sure you have your match funding. That is really important to partner with local governments and or foundations and partners to ensure that you have that match component, because most of our funding require either a 50% match for operations based off of individual income or agency income and or in-kind or foundation dollars, or a 20%, depending on if you're trying to purchase and or doing operations. It's really important. That's something that I wish somebody told me earlier, during the start, is, kind of building a bigger bucket for us to get, the right amount of funding for service. Thank you.
This is great. Thank you so much, Victoria. This is wonderful. Again, if you have any follow-up questions, feel free to drop them in the chat and we can address them offline and or at the end of our 3-speaker session. And so now we're going to move on to our second speaker. And Duncan is actually from APANO, the Asian Pacific American Network of Oregon. And Duncan grew up in a Taiwanese American household in rural Upper Michigan, and he first became politicized while attending the University of Michigan, where he obtained his BS of Arts in Poli-Sci and Asian Studies. After graduating, he worked as a field organizer for national nonprofit focusing on voter registration and GOTV campaigns. Duncan then moved to Portland, Oregon, and obtained his JD from Lewis and Clark Law School in 2007. After becoming an attorney, he relocated to Asia to practice international corporate law, advising Fortune 500 companies on their cross-border merger and acquisition activities. He was looking for more socially conscious work, so he returned to Portland and served as APANO's associate director since 2013. And now he works across APANO's programs with community development, policy advocacy, organizing, and cultural work programs, ensuring that they have the tools and resources needed to be successful. Duncan's areas of policy work focuses primarily on housing and transportation justice. And now I turn it over to you, Duncan.
Okay, great. Thanks so much. And thanks for everyone for joining us. So again, my name is Duncan. I use him, his pronouns, and I'm with APANO. We're based in Portland, Oregon. We're a culturally specific organization, and our mission is really to work on systemic change. So we do organizing, policy advocacy, leadership development, cultural work, and then we do some social services and community development as well. So we also have a place-based initiative that's focused in East Portland in a neighborhood called the Jade District, which I'll touch upon a little bit more later. And then we also have a sister C4 organization that does political campaign work. I think this presentation is really focused on our approach to housing and meeting housing needs within our community. But we're not a community development corporation or a CDC, so we don't really engage too much in actual construction of housing. It's more about the systems that foster that. So next slide, please. Yeah, so we're headquartered in the J District, which is in East Portland. It's home to about 25% of Portland's, Asian American population. We have lower median family incomes than the rest of the city, and about 71% of our households here are limited English proficiency. It's one of the most diverse neighborhoods in the entire state of Oregon. So this kind of feeds into some of our challenges when we try to address like digital and economic and cultural divides in the work. Next slide, please. So we take a really holistic approach to community development under kind of the social determinants of health lens. We know that there's no kind of magic bullet that leads to like an empowered and healthy neighborhood or community. So housing is just one piece of it, but we also work on economic development, parks and green space, air quality and water quality, and making sure kind of like access to education and food and childcare are available. So we're really focused on building kind of human capital and political capital. And I think that's the frame from which we approach our work. And it's really about how do you build a cohesive community that can tackle shared problems, right? Like, a lack of affordable housing or public health outcomes that requires us to all work together. Next slide, please. Yeah, so the strategies that we're really highlighting in this case study were really around building the capacity for our residents to advocate for change. And that means building an interconnected community with a sense of identity and ownership, and then fostering a sense of self-determination by learning about your rights. So in Portland, as in many kind of like high-cost areas of living, we've seen annually 14 to 15% rental increases. That was pre-pandemic. So the housing pressures on our residents, and then also rising commercial costs on small businesses has been keenly felt as a kind of after effect of gentrification. So how we address that is really kind of like the core of our work. Next slide, please. Okay, so we have two poll questions. Oh, sorry, go ahead.
Yeah, so now we want to hear from you, the participants. We want to know in your communities, how has the pandemic affected housing costs in your city? Have rents gone up? They have gone down? They have stayed the same, or you're not really sure right now? Okay, this question is specifically for renting, and then we're going to ask a different question next. All right, a few more seconds. I'm going to be closing in 5, 4, 3, 2, 1. Okay, so 42% are not sure, but 24% of you think the rents have gone up. 21% say the rents have stayed the same, and 13% say that rents have gone down. So it's very variable. And then the next question that we have is about the price of purchasing a house. So in your communities, in your states, has the price of purchasing a home has gone down or up? So options are prices gone up, prices gone down, have stayed similarly the same, or you are not sure. And we're going to allow a few more seconds. All right, so 5, 4, 3, 2, 1. Okay, so again, 41% are not sure. 38% say that the prices of houses have gone up. 13% say they have stayed the same, and 9% have said that they have gone down. Thank you, everybody.
Cool. Well, I think, this is really specific to kind of the market that we're in, but like in a lot of higher cost of living areas like West Coast cities, we've really seen kind of rents begin to go down. I think there's a lot of pressure or there's a lot of interest in moving, especially during the pandemic, to, lower cost areas in the suburbs or outside the suburbs, seeking affordability and not really, needing to commute close into your job. We've also seen the housing market increase a lot. Like housing prices have gone up, 8 to 10%, I'd say, the last year in the region. So that really, what that really speaks to is like we're seeing a K-shaped recovery, where those that were the most vulnerable or frontline workers have experienced economic hardship, while many of the white collar workers or those in privileged positions have actually seen their economic positions improve, and also putting pressure on the housing market. So that kind of, I think that there's a lot of like research that still needs to be done, to analyze the last year or so. But that's kind of like the backdrop in which we're working now. So there's definitely a breaking point pre-pandemic where, the housing costs and displacement were at the top of our list. And during the pandemic, we've lost a lot of our anchor businesses. There's a higher unemployment. So, there's a need for more affordable housing, but there's actually a sense that there's a little more of like naturally occurring affordable housing, available. Next slide, please. So I think in our transportation or in our housing conversation, we can't discount, the impacts of transportation, especially, for us. So we're in construction right now for a rapid transit line that goes through our neighborhood. And that's had really, large consequences for our community, both in terms of the planning and the construction and the future impact on property values, which would, lead to displacement. This is actually a picture of me accepting an $82 million novelty check from the FTA on behalf of the community for the transit line. So, it took a lot for us to get to a place where we felt like okay about taking that money for the transit line, just because we wanted to make sure that the community was protected during that process. Next slide, please. So yeah, I mean, our neighborhood's really located in, a classic environmental justice concern neighborhood. We're kind of boxed in by two state highways, so 82nd Avenue and I-205 to the east and west, and then two high crash corridors to run north and south. This has led to, a lot of pedestrian fatalities. We have increased asthma and cancer rates. We have rising property costs. And then there's a chronic investment in underinvestments in infrastructure. I think we're also parks deficient and lack sidewalks in a lot of places. I actually went to an Asian American Advancing Justice conference like 2 years ago in Atlanta, and I got to tour Buford Highway. So I think that's kind of a very similar model, like 82nd Avenue. Actually, like I was on Buford Highway, and there was like a lot of the same businesses with the same names. So it has that kind of suburban feel as well. Next slide. So our first chapter is really around kind of like knowing your neighborhood and, diving down in the data and employment rates and rental rates and things like that. And the second strategy for us has really been to empower and advocate for our community. So we do TENANT organizing, community development or community organizing, leadership development, advocacy. And when we complement that with some of our social services like small business advising, we have a rental assistance program, food security, and workforce development. So really kind of using our services as a gateway for folks to engage more deeply in the kind of civic and political process. Next slide, please. One of our cool programs I wanted to lift up more was our placemaking program, which we do under cultural work. And this was really in relation to the transit project coming from the neighborhood. Placemaking was a way for us to really engage new folks through creative means. So we would fund local artists that live in the neighborhood to do permanent or temporary installations, and they would all feed into somehow like informing the transit project. Next slide, please. So a lot of their work focused on the need for affordable housing and talking about rising rents and like bring some real kind of neighborhood attention to that. Like people are doing like music performances or parades or murals. So you see that kind of throughout the neighborhood. Next slide, please. But a placemaking project also impacted, the actual alignment of a transit project itself. So this is like one of our anchor businesses, Canton Grill. They've been here for 76 years, and they were actually on the chopping block basically to be acquired and demolished for the transit line. And part of their story was told to the decision makers, and they ended up having to change the actual alignment of the project to preserve some of our historic spaces. Next slide, please. Yeah, I think there's a big element of also remembering our past. So I think we always like to start with land acknowledgements, for the indigenous community and for this neighborhood. We had a substantial Japanese American community that also lost their land in the internments. This was all kind of agricultural land back in the 40s and 50s. So we like to, recall the history of the neighborhood. Next slide. And then also working to reclaim space. So we have like these like old school overhang pedestrian bridges that we've kind of reclaimed to the community to make them community icons. And under this particular bridge, we've had 4 of our elders die in the last 4 years. So it also serves as kind of a memorial. They're all Asian American seniors over the age of 60 that happened that night. So it's clearly a systemic issue, and it's not like random happenstance. So this is the point of this one. Next slide. We also do an annual night market, and highlights all our local businesses and brings. I think we had like 20,000 folks come out for the last one. In the summer of 2019, we weren't able to do it this year, obviously, because of the pandemic. So all this to say is, we take a really holistic approach to building that neighborhood identity through, events and, permanent installations and all that. And, the goal is to turn that into concrete change on the ground. Next slide, please. Yeah, so in developing the transit project, right, like we knew there was this project coming through, was gonna bring new folks to the neighborhood, was gonna be disruptive from a construction standpoint, was probably gonna raise housing prices. So through these different strategies of organizing, placemaking, we were actually able to negotiate a community benefit agreement with our jurisdictional partners at the city and at TriMet, the transit agency. And some of the highlights we got were 300 to 600 units of affordable housing in East Portland along the transit line, which they're all under construction now. We got a small business mitigation fund to support businesses during construction. And then from the service hours saved from the new transit line, we got a new north-south line put in to better serve our community. So for us, the transit project wasn't just a transit project, it was a community development project that led to all these other community benefits as well. Next slide. So I think that we have just a couple of slides on tenant organizing. I think our strategy was that we would organize tenants to resist illegal rent increases through different partnerships with legal aid until our affordable housing came online, and that's worked out relatively well. A lot of folks actually ended up being able to buy their own place, which is awesome and phenomenal. But some folks, were able to move over to the new affordable housing. Next slide. We've also done parent organizing. So I think it, initially was focused on education and engaging with our school system. But since so many folks were facing housing instability, it actually moved over to advocating for tenant protections and affordable housing as well. Next slide. We also have a formal leadership development program called the Climate Health and Housing Institute. It's a 4-month cohort program. And I think the goal, I think kind of like what we talked about in the previous presentation too, was, we need to go from community input that's like not just the rent is too dang high, but like the solutions that you need to do something about it. So if you do light touch community engagement, you're gonna get like the street's not safe, or rent is high. But I think like being able to bring your own solutions to be like, we need affordable housing here, and here, and this is how you pay for it. Like that's the level of engagement that we want our community to be able to get to, right? So I think that requires that specific investment in longer term, leadership development. Next slide. Finally, again, we're not a community development corporation ourselves, but if our goal is to get API folks into affordable housing, we don't have to build it to accomplish that. We can do that through partnerships. So this is one of our partnerships. We partnered with a local CDC to build this affordable housing development. APANO is like a part owner in it. And we actually run a ground floor like community center, and our central offices are here as well. So yeah, just exploring partnerships like that, if you're not a CDC, has been a really effective strategy for us. Next slide. So we did that through just like being really intentional about it, finding the right partnerships. We had cross-board pollination, and building kind of that long-term partnership has, moved us up to kind of like the joint like partnership and development kind of model, which I think has been really great and actually meets the needs of our community without having to like have a development team and all that, access to capital to build a housing development. Next slide. So I think the bonus strategy, for us has really been building long-term political power. So we have a C4 now that we've been running for a couple of years, and we do political endorsements and campaigns. And we actually recruited one of our staff to run for state legislature, and she won by 88% of a vote in our neighborhood. And is actually the first Asian American legislator in 20 years in Oregon. So I think, like it's not just enough to have some input, but you got to be at the decision-making table as well. And you're not going to be able to do that unless, you're just really clear about the outcomes that you want, and really, having a legislature or city council that reflects, your community and has your community's interests at heart. I think that's it. Yep, that's it. If you have any questions, here's my contact. Thank you.
Thank you, Duncan. So we do have a couple questions for you. How have you addressed issues about gentrification in the J District? What specific activities do you undertake when it comes to that?
Yeah, I mean, there's no magic bullet for gentrification and displacement, right? So I think part of it is like, of course, you got to build the affordable housing so folks have a place to stay. You got to support your local business community. I think so many of our housing residents work in the local shops and restaurants. So you got to, have that thriving business community. We're tiptoeing into workforce development. Like you got to have your people have good jobs to be able to, afford to be able to stay in the neighborhood. And we do a lot of policy work in terms of like tenant protections at city council, things like relocation fees and no cause eviction regulations, and also in zoning. So a lot of that stuff is kind of like more arcane and boring, honestly, but all of that together is really like this holistic approach to having community control over how the neighborhood develops.
Great. And the question that always comes to mind, what about COVID? Has the pandemic impacted your work in advocating for you?
Oh, yeah. I mean, I think we've really increased our like direct kind of support and community assistance. So things like rental assistance and small business grants and things like that. That's been critical to kind of stabilize the community. At the same time, we've lost a lot of our anchor businesses. So some of the biggest like shops and restaurants have closed shop. So in some ways, the neighborhood's more of a ghost town. So I think we were really concerned about gentrification, but I feel like we've been set back maybe 5-10 years, which might not be a bad thing. I don't know, but I think it really, has impacted the social and economic fabric a lot of the neighborhood. And I think it's really heartbreaking, but it's also an opportunity to be thoughtful about how we build it back in a sustainable way.
So due to timing, we're going to be able to only answer one more question. Duncan, there's some questions for you on the Q&A, so you can chat. And we're going to go ahead and move forward with our next speaker.
Much, Duncan. Now we're going to move on to our final speaker for this session. We're going to speak with Elaine, and she is from ASIA, Asian Services in Action. And Elaine serves as the CEO at ASIA. In this role, she's responsible for leading the largest health and social services agency in the state of Ohio, focusing on empowering Asian Americans and Pacific Islander immigrants and refugees. ASIA's mission is to empower and advocate for AAPIs so that they can have access to quality, culturally and linguistically appropriate information, health, and social services. Elaine oversees a leadership team responsible for direct health and social services, policy advocacy, capacity building, civic engagement, and special projects. She also has the responsibility for ensuring compliance of the requirements for ASIA's International Community Health Center, a federally qualified health center. And with that, I'm going to turn it over to Elaine.
Hi, everyone. Elaine Tsao here from ASIA. I'm so inspired and also honored to have learned so much from Victoria at CPACS and Duncan at APANO. So hopefully I can impart a little bit of information to expand your knowledge about accessing primary care services for the immigrant refugee community that we're serving here in Northeast Ohio. So just a quick roadmap of what I'm going to be talking about today. I'll be sharing about ASIA's and its International Community Health Centers services. I'm going to talk a little bit about who the immigrants and refugees are that we're serving. I'm going to touch upon culture and how it's important to delivering the services that we provide. Of course, the importance of language access. I'm going to share some practice pointers and, as with all the other panelists, talk a little bit about the impact of COVID on our services. Next slide. So as Jeannie already shared, ASIA's mission is to empower and advocate for the Asian American and Pacific Islander community and to provide AAPIs and other communities with access to quality, culturally and linguistically appropriate information, health and social services. ASIA is a 501c3 organization, and we are headquartered in Akron, Ohio, but we provide services across Northeast Ohio, which includes the cities of Cleveland and Akron. So, oops. Go back one slide, please. So the delivery of ASIA services is, using, a no wrong door approach. So whenever someone comes to our organization, no matter what it is that they are seeking services for, we approach whatever their circumstances are and ask them, what their additional needs may be so that we can provide internal referrals across the different departments that we have in the organization. And they're listed here. So we provide, sustainability services, which is everything that a new arrival in this country, may need some sort of assistance with. We have an AHIMSA program. AHIMSA is a Sanskrit word for peace. And this is our domestic violence, sexual assault, and human trafficking support department. We have aging and adult services. We have legal services, which encompasses family law services, immigration legal services, as well as representing victims of crime in the courts. We have a civic engagement department. We have children, youth, and family services. Of course, we have interpreting and translation services. And more recently, we have launched the Apex Fund for Economic Opportunity. This is a program that provides support, technical assistance to entrepreneurs who are interested in starting a small business. And of course, last but not least, is the topic that I'll be primarily focusing this conversation on, which is our International Community Health Center. We are a federally qualified health center, and we're providing our primary care services in language, in a culturally and linguistically specific manner. Next slide. Okay, I guess we have a poll.
Yes, we have a quick poll here. So the statement is, refugees and asylum seekers follow the same legal processes to enter the United States. Is this correct? Is this true or false? All right, a few more seconds to answer. I'm going to close in 5, 4, 3, 2, 1. All right, so 76% said that this is false and 24% says that it is true. Elaine?
Yeah, so it's great to see that you know, the majority of the attendees are familiar with the difference between refugees and asylum seekers. You know, there's, you know, immigration covers the overarching concept of, you know, a population that moves from one country to another. But underneath that umbrella, there are subcategories of individuals who are, you know, moving from their country to another country for different reasons. And, you know, refugees are a category of individuals that really don't have a choice in their move. They're generally fleeing persecution, and they usually cannot return to their country of origin. Whereas asylum seekers, they're different from refugees in terms of how their immigration status is processed. An asylum seeker, you know, has to prove that their circumstances qualify them as a refugee. So there's an additional burden that they have to overcome to adjust their immigration status. So next slide. Yeah, so you know, the organization Asian Services in Action, you know, it was founded because at the time, you know, 25 years ago, there was a large influx of immigrants and refugees coming from the continent of Asia. And just wanted to show you a quick map and comment that, you know, it might be shocking to most people that 60% of the entire world lives on the Asian continent, and just how diverse Asia as a continent is. You know, there's 48 different countries within the continent of Asia, and there's just as many, if not more, ethnicities and languages represented across the Asian continent. Next slide, please. Well, yes, and here's the table that just kind of identifies the different subcategories of immigrants and refugees. One that I didn't get a chance to define earlier after the poll was the internally displaced persons. These are individuals that are similar to refugees, but they're different in the sense that they're literally on the run within the borders of their country of origin, while they are, you know, hoping to achieve refugee status. Next slide, please. Okay, another
Right,
poll.
and we have the last two polls. This is a comparison about refugees within the last 8 years. So the first poll is asking how many refugees were admitted in the United States between 2012 and 2016. We have 4 different ranges between 20 and 40,000, 40,000 to 80,000, 80,000 to 160,000, and 160,000 to 320,000. All right, a few more seconds. 5, 4, 3, 2, 1. We have a mixed result, Elaine. We have 37% said the range is between 40 and 80,000, 26% between 80 and 160, 22% is 160 to 320,000, and 15% say between 20 and 40,000. Before we go to the next question, would you like to tell them the answer?
Actually, I'd like for them to see the next poll, just to compare it first, and then I'll tell them the actual numbers.
Great. All right, so question is very similar. We want to know, what do you think about how many refugees were admitted in the United States? And this time is between 2017 and 2020. Same ranges, 20 to 40, 40 to 80, 80 to 160, and 160,000 to 320,000. All right, 5 more seconds. 3, 2, 1. Okay, so this one is less diverse in answers. We have 52% saying between 20 and 40, 32% between 40 and 80, 12% 80 and 160, and 4% between 160 and 320.
Okay, yeah, thank you. If you could go to the next slide. So this is the actual data regarding the U.S. refugee admissions over the past 40 years. And, you know, I grabbed the data from these data points, and, you know, and you can see also just kind of eyeballing that between 2012 and 2016, the U.S. admitted about 300,000 refugees. So that's, you know, during this era here. And then in the most recent 4 years, the US admitted less than half that number. So about 138,000 during the past 4 years. So a significant drop in the number of refugees that were admitted to the United States. I don't know if anyone finds that shocking. I personally do. And I hope that the doors to this country will be open again. Next slide. So a little bit deeper dive into the demographic of immigrants, refugees that we're serving at Asian Services in Action. So, you know, Asians are the fastest growing racial group in the state of Ohio. And, you know, even though it may only represent like 3% of the total state population, the Asian population has more than doubled over the past 20 years. And, you know, nearly, you know, more than half of the Asian population in this group was born outside of the United States. And 33% of that group are of Asian Indian ancestry. And, you know, more specifically, over the past 10 years, there were 11,000 refugees that were resettled in Northeast Ohio. And remarkably, 70% of them arrived from the continent of Asia. Across the Northeast Ohio, Cleveland, Akron metropolitan area that we're serving, there are 92,000 Asian Americans. And Asia is currently serving just under 60,000. Next slide. Similar to the other presenters, you know, approximately 75% of Asian American Ohioans speak a language other than English at home. And English proficiency really varies depending on the country of origin, because some countries had a situation where formal education was taken away from the population. So, you know, I guess access to learning English and the ability to learn English was affected by that as well as traumatic experiences that refugees may have experienced on their journey to this country. So in the situation where an individual came from a country where they did not have access to literacy, we have to provide our services through spoken word because they cannot read in any language. Oh, and also our International Community Health Center, we became a federally qualified health center in 2013, and we opened for business in 2014. Next slide. I think one of the reasons that our organization participated in this case study was because, you know, Cleveland is known as a place where there are, you know, very, very prominent hospital systems. You know, there are hospitals literally around every corner. But I think that for our community members, there's a difference between proximity, you know, having a health center around the corner and being able to access the health center that might be around the corner. Most of our community members that we're serving, they're hesitant to go to such a large hospital system, which can feel overwhelming. I've heard community members describe going to a much larger hospital system, like feeling like they were at an airport, like they had just arrived at a very busy airport, and they felt overwhelmed, and it was challenging to navigate such a large system. You know, whereas Asia's International Community Health Center, we have, you know, team members who are from the communities that we're serving, and patients are able to see faces that resemble theirs, so they feel much more comforted and reassured about the care that they're about to receive. Additionally, you know, for many immigrant refugee communities, preventive care is a new concept. You know, healthcare in some countries is rare. So we have an opportunity to educate this community about preventive health. Yeah, just a little bit of information about our staff. Approximately 80% of our staff are bilingual or multilingual, and they understand some of the amplified stigmas that exist in their communities. You know, for example, you know, there are some communities that have such extreme stigmas around behavioral health and mental health that they're not even willing to be, you know, to share their challenges with behavioral health and mental health. You know, there was a patient who was being treated for depression, and, you know, she described the medication that she was taking as her heart medication because she didn't want to feel ashamed, you know, to her family and friends that she needed some medication for depression. Additionally, there are other communities that refuse to take any medication at all. And so for that reason, you know, we offer acupuncture services because there are some community members who prefer receiving acupuncture for pain management over any type of pain medication. And you know, it may surprise you that the top 5 languages that, you know, Asian Services and Actions International Community Health Center are delivering services in are Chinese, Nepali, Burmese, Karen, and Congolese. But as I referenced earlier, you know, there are, you know, we serve all immigrants and refugees and all community members in general. But there's a newer wave of refugees coming from the Congo. let's see. Oh yeah, one other thing that I wanted to mention is that, you know, community members, they prefer in-person interpreting, and in-person interpreting is provided whenever possible. But, you know, unfortunately, sometimes only remote interpreting is available, and particularly during COVID now, but there are those challenges. Next slide. Yeah, as I referenced, you know, some of the community members that have come to this country have experienced extreme trauma. And so it's extremely important for our delivery of services to come through a trauma-informed sensibility. Next slide. Okay, and I'm going to talk a little bit about culture. You know, culture is very complex, and you know, it takes a great deal of awareness, you know, flexibility, you know, openness and adaptability to swing in and out of different cultures while maintaining your own sense of self. I mean, a lot of times, you know, you hear people talk about like assimilation into this country when in fact, you know, that's probably the worst thing that could be imposed upon someone new in this country. You know, the goal really should be integration, you know, to have someone preserve their the culture and beliefs and language, you know, from their country of origin, while blending in to their new home environment. Next slide. Yeah, this culture wheel, you know, is really just kind of you know, just a quick summary. I know we're short on time, so I'm kind of rushing through now. This culture will represent some of the various things, but I think that most important in understanding culture is to respect that cultural differences exist. So next slide. Cultural humility. Next slide, please. This is extremely important and critical to ensuring that you know, we're respectful and you know, community members are not going to trust someone who comes in with, you know, assumptions and not respecting where the individual is coming from. I guess I'll kind of fast forward to the practice pointers real quickly. Next slide. Yeah, so you know, these practical pointers, you know, I think my first bullet point, it says like, think cultural humility over cultural competence. You know, I think it's important to focus on inviting the immigrant and refugee, you know, to share their culture with you, instead of attempting to show how much you think you know about another person's culture. And I think that that's the starting point, you know, is to always come asking more questions than making declarations, you know. So instead of saying, you know, I know your culture does X, Y, or Z, you know, that's the wrong approach. The better approach would be to ask, you know, how does your culture address, you know, X, Y, Z? And that in that way you're meeting the client and the patient where they are. Let's see. Yes, next slide. Another practice pointer that I'd like to highlight is, you know, just kind of an assumption that someone from a particular ethnicity automatically speaks a certain language. There are so many different dialects, and there are so many different reasons why someone might speak a language other than their country of origin. You know, for example, you know, there are Bhutanese refugees, but they don't speak Bhutanese. They speak Nepali because they were, you know, forced out of their country of origin into a refugee camp in another country where they speak a different language. So their ethnicity may be different than the language that they learned to speak. And absolutely not to make overgeneralizations about any one community member representing the entire community, you know, that's extremely important to acknowledge, because those types of stereotypes, you know, create other anxieties and pressures. Next slide. Let's see. Yes, so you know, I'm just gonna go to the bullet point, you know, about meeting clients where they are and being adaptable and flexible. You know, just one example about, you know, respecting rather than, you know, kind of causing more problems about a person's cultural or family obligations. You know, for example, you know, the stigma around mental health or behavioral health, you know, rather than I guess like amplify the stigma, you know, really just kind of adopt the individual's perspective and frame it in a way that is helpful and healthy for that individual. You know, if it makes that individual feel better to refer to her depression medication as her heart medication, you know, that's okay, as long as she's taking the medication and receiving the health services that she needs. Next slide. Okay, working with interpreters. So, you know, a lot of times people think that, oh, well, if you have an interpreter and you're working with a limited English proficient individual, then all your problems are solved. But that is the furthest thing from reality. There are so many different aspects of interpreting that, you know, really requires someone. You know, just because you're bilingual or can speak another language, you know, that doesn't make you an interpreter. You know, there are a whole series of, you know, training and ethical responsibilities that come along with being an interpreter. Next slide. Yes, something key in the interpreter space is, you know, really being able to provide unbiased interpreting. You know, it's problematic. It's problematic when, you know, family members or things like that are inserted into the position of interpreting for another family member, because the tendency is to, you know, alter what the message is based on whatever their bias or, you know, motivations may be. And so that's why we always recommend that, you know, someone that does not have a connection to the individual be the one providing the interpreting services. You know, so next slide, please. Yeah, so, you know, instead of, you know, when an individual is providing interpretation, it's so important to speak to the patient or client rather than speaking to the interpreter and telling the interpreter, you know, tell the patient this. Rather, you know, rather to speak directly to the patient client and say, you know, I need you to take this medication because it will help your you know, your issue in this area, rather than, you know, tell the patient that she needs to take her medication, because it's not, it doesn't reflect the like sincere care for that patient or client. Yeah, and additionally, you know, a professional interpreter knows when to, you know, stop perhaps like a long series of, you know, statements, so that, because it would become too much information for the patient or client to listen to a very long series of statements without having the interpreter interpret in kind of natural chunks. So Next slide. Yeah, so I already talked about some of the first two bullet points, but you know, it's also important culturally to find, you know, what I've characterized as a good fit for the interpreter whenever possible. You know, there are some community members, you know, where, you know, sensitive topics in healthcare related to, you know, gender specific healthcare needs, you know, it's much better to have a interpreter that's aligned with that particular gender healthcare need. You know, just as one example, you know, I grew up in an environment where my mom was providing interpreting services for pregnant women, and you know, her and her two brothers, you know, were, you know, bilingual, and yet, you know, when they needed interpreting services for pregnant women, they did not ask her brothers to provide the interpreting services. They asked specifically for my mom. So, you know, those types of alignments are extremely important. Next slide. Okay, so these are just a couple of examples of, you know, if you go to a client or patient's home, this is all obviously pre-COVID, you know, if you went to their house, you know, you know, should you remove your shoes? You know, do you have to dress a certain way? You know, should you accept food if it's offered? You know, should you be the same gender? All these different types of questions. They are important, and the answer to these questions depends on the individual that you're working with. And I guess most important to take away from these examples is simply to ask, you know, if rather than assume anything. So if you are working with a client or patient in a different culture than yourself, ask those questions. And there is nothing wrong with asking those questions. It in fact builds trust to ask those questions rather than assume. Okay, I'm sorry, I had to rush through that presentation, but I'm ready for any questions.
Thank you so much, Elaine. So just like the other speakers, we would like to know how COVID has affected your services and your community in specific.
Sure. So, you know, it's kind of remarkable, but like it was literally 1 year ago today that I first heard about COVID-19. And coincidentally, it was the start of, you know, the Lunar New Year or Chinese New Year. And in Chinese culture, you know, there's this this belief that, you know, it's bad luck to take medicine or go to the doctor around New Year. And it's out of this this belief that if you go to the doctor around New Year, then you're going to be sick the entire year. And so we had already seen a decline in Chinese patients, you know, kind of rescheduling their appointments around this time. But then it really hit us that, you know, community members who were returning to Ohio after traveling to visit, you know, family members for Chinese New Year, that just more and more of the appointments were being rescheduled. And then eventually we were in a situation where community members were just staying at home and not coming to the health center out of fear of COVID. And, you know, one way that we were able to pivot our services is by offering telehealth, but I guess there's a further story to the telehealth option. And that is that telehealth, it's not really designed for patients with limited English proficiency. You know, as I already shared, limited English proficient patients, they prefer in-person appointments. So telehealth is not in person. And additionally, you know, limited English proficient patients are typically digitally disconnected. So, you know, they wouldn't be able to connect on a virtual platform, but they might be able to connect on the phone. But even if the patient has an internet connection, integrating an interpreter into a telehealth appointment, it has its own like technological challenges. And furthermore, it's harder for the patient to understand the interpreter through that virtual connection than if they were in person together for the appointment. So we faced all of those challenges during this COVID time. But despite those challenges, you know, telehealth, it really has been a life preserver for us, because if we were not able to even provide telehealth care services during the pandemic, you know, we might not have made it out, you know, to this year.
Thank you, Elaine.
Yeah.
And we're going to open the Q&A for all of our speakers, but I do have a question from you, Elaine, from one participant. Other than stigma around mental health and language barriers, how would you characterize the top barriers to increase access to mental health services among people with low English proficiency that are trying to integrate with their newfound homes?
Yeah, so that's a complicated, that's a complicated question. You know, the more that, I guess, you know, community members within the same community reassure each other that it's okay to need help sometimes, the more that tide will shift in terms of the stigma. And so the fact that we at our International Community Health Center, we have mental health practitioners who are from the communities that we're serving, you know, just by saying, you know, that it's okay to feel how you feel, or it's okay to not be okay. That level of reassurance coming from a face that resembles theirs really has a deep and lasting impact.
Great. You have a question in the chat if you would like to answer that while I open everybody's camera and asking all of the speakers a few final questions. So when it comes to COVID, I know all of you are servicing the, you know, your community, your Asian American communities, but with the stigma that COVID has created for this particular community, what kind of outreach are you doing or have you been doing? Not necessarily towards your Asian American community, but to protect your Asian American communities from this type of stigma associated with COVID. Are you outreaching to other communities or having any type of initiatives? Anybody would like to answer? Duncan?
Yeah, I mean, in Oregon, just this summer, the state Department of Justice tracked a 360% increase in hate and bias incidents reported to the state. And a big chunk of that is from Asian American communities. I think that's happening nationwide, you know, so I think during that, we really invested in our cultural work program to push back against harmful narratives. So we had positive stories of Asian Americans, you know, helping out and buying masks for folks or distributing PPE or, you know, just pushing back against that harmful, you know, immigrant narrative. We also have a resource guide for responding to hate and bias incidents that we put out that you can find on our website. I think it's pretty Oregon specific though. And really just, you know, tracking, you know, all the areas where you can go and report incidents and get some, you know, support or just making sure it's tracked in general. Yeah, I think we're still struggling with like how do you respond to violence because of the interaction with law enforcement. So we're not suggesting that folks go to law enforcement unless, you know, it's a violent attack, but like making sure there's resources available for tracking and mental health and stuff like that.
Thank you. And I guess the last question, because of timing, would be, do you have any advice, any tips for our panelists who not necessarily work always with the Asian American community, but really would like to improve the services when that happens, or they're thinking of starting to outreach to this community because it's increasing in their areas? Any final thoughts on this?
Yeah, maybe I'll take a quick stab at that question. And it's about building long-term relationships and not just dropping in and helicoptering into the community when there is a need. It's building that trust prior, and that's something that we always advocate when we work with legislators who maybe are now new to a certain district or a district that they're looking into, or partners coming in and wanting to expand out to the API community. Being authentic with that means like being there when those communities have needs, like our various ethnic API or Latinx or other groups have needs, and being able to lend a hand and not just only being available when their departments or their agencies need something. And I think that's really important to cultivate that trust, at the beginning, and making sure that it is not something that the investments have to be made, right? Whether it be funding for interpretation, translation, funding for our staff, right? Or funding to bring partners like us to the table at the beginning and not at the tail end of some of these grants that are targeting our communities.
Great. Well, I know that we're way over 20 minutes. Can't thank you all enough for staying on the webinar with us. In the interest of time, we will send out the webinar details, the recording, the resources, contact information for all of our speakers, and then also the community highlights case studies that our speakers have mentioned. And also, I would like to put a plug in, please continue to keep following us, because we do have the series for Raising Voices that you'll also find within the webinar details. So thank you again for joining us, and we wish you a good afternoon and evening ahead.
Thank you.
Thank you.
Thank you. Take care.